Hello, everyone, and thank you for joining us today for the University of Calgary webinar on equine sports medicine. What do we know about horse athletes? I will be introducing you to our expert in just a moment, Renaud Léguillette. First of all, I'd like to do a couple of housekeeping measures. My name is Kelly Johnson, and I'm a member of the team at University Relations here at the University of Calgary, and I will be your moderator today. This webinar series is by our University of Calgary scholars. Information presented is a summary of the scholars' research. You can submit your questions throughout the duration of the webinar. You should see a question screen on your monitor now, or you can keep the conversation going live on Twitter using the hashtag ExploreUCalgary. Today we're going to be hearing from one of our experts, Renaud Léguillette. And let me tell you a little bit about Renaud, as you can see his credentials there on the screen. He's an associate professor of equine internal medicine at the Faculty of Veterinary Medicine at the University of Calgary and the Calgary Chair in Equine Sports Medicine. His research areas include inflammatory lung diseases and equine sports medicine with a focus on cardiorespiratory physiology. Thank you for joining us today, Renaud.
Thank you very much, Kelly, and thank you everyone for joining in. So it's really a pleasure to be able to talk about, these amazing athletes that are the horses. And so today the plan is really to go over an introduction on, how do these horses are, able to move that fast and for that much, that long. And then we'll go over the limiting factor, what is really the limiting factor in this performance. And then we'll go over what can go wrong. So what can go wrong in their metabolism in terms of, throat problems, upper airways, we call them, lung problems, cardiac, so the heart problems. And we'll cover also some treatments to help these horses to go through these activities.
And I think, we were just looking at a video of a chuck wagon race and seeing those magnificent animals going by, but your studies look at all types of activities that horses do.
Yeah, absolutely. So, horses are, they're going fast in a straight line, fast, turning in tight circles, jumping, going for endurance, pulling, as you can see on this picture with the pulling events, interacting with like cow working horses too. So, these horses can do a lot of different things. And I like to, go in the field for my research and cover actually different of these disciplines for sure and help the horses perform better in each of their own discipline for sure.
And I think that's an important aspect of the research that you do here. It's not just about being in the laboratory. It's about finding those practical elements to help people with their animals in their home environment.
Yeah, absolutely. I always say I like to be outside in the field and understand better what the challenges are for the industry and the horse owners and trainers. It helps, definitely raises lots of research questions, and then we address them, with some field studies as much as possible, and then we publish the results in open access journals that are accessible to everyone, as much as possible. Yeah. So, the research in equine sports medicine is really fascinating. So when you see a horse galloping that fast, so this is 500.
He does make noise for sure.
Going 70 kilometers an hour, right? So it begs the question: how is it possible? Like how do they do it? And that's what we are going to cover. In the first part today, I'm going to try to introduce some basic, elements of the physiology, exercise physiology of these horses. We'll go first, to be able to reach these speeds for so much with so much endurance, they need to be very efficient in the way they move, which I will briefly cover, but it's not the topic of my the main focus of my research. And then, of course, what I'm really interested in is, how do they take up all this oxygen from the air, the respiratory system, basically, to provide fuel and energy to run, and how do they distribute and push this oxygen into the muscles? So that's more the cardiac, the heart, that is, pushing all the blood. And then I'll show you briefly that they have also their own blood doping system, which is part of the explanation of how they can run that well. And also they are very tolerant to running when they are lacking a little bit of oxygen. So let's go over these elements one by one quickly here. So as I said, the locomotor apparatus, so the legs is not my focus of research, but it's still fascinating. If you look at this picture of this horse, you can see that the legs are actually very thin, right? I mean, there's not much muscle on these legs. And so these drawings on the right are showing a horse leg with these bar charts. And you can see really it's mostly bones and tendons at the bottom, and the red is showing these muscles that are more at the top. Versus on the right side, you have a human leg. And what you can see is, for example, we have these calf muscles that are really heavy and, hard to, throw forward and back, right? So this is really creating some inertia that the horses don't deal with. So that's one first, adaptation that they have for sure is they really gallop on one digit, so on the finger, so they have all these muscles up. The other adaptation for their locomotor apparatus is they have a spring system. So this spring system in the legs is shown in this graph here in these pictures. I try to represent that. So it's briefly, when the horses are touching ground, the weight of their body is basically pushing down on these legs. And so the legs are, you can see the fetlock at the bottom of the leg. The legs are bending, if you want. And these pulls on the tendons and ligaments on the back of the leg. So it's like a spring that you are stretching with zero energy expense. It's really just by hitting the ground. And then this energy is accumulated in these springs, in these tendons, and the tendons are going to, right away shorten and bring and lift the leg again without any muscle contraction, just free of energy. And so this is also explaining why, they're efficient, but also why they can have some tendon injuries, because these tendons are working really hard, stretching and shortening again. So that was for, some explanation of, the legs and the efficiency of the locomotion, which is incredible. But my focus for my research is really more the lungs and the respiratory system. And these are a few numbers here I'm throwing. So if you compare horses to humans, right? I mean, if you have a human at maximum performance running as fast as you can, you may be able to breathe between 100 or at least 200 liters per minute. While the horses will breathe much more actually than 1,500 liters of air per minute. So that's really incredible. So it's really like a big vacuum. And why is that? It's because they have these huge lungs. And so the lungs are extending very far back on the back of the horse. And I always tell the owners, your saddle, when you're sitting on your saddle, you're really sitting on the lungs of your horse. And these lungs are fascinating, and I've always been interested in, working on the lungs, because they are really the interface between the air outside and the blood inside. They are where, oxygen is transferred from a gas in the air to something that is dissolved into the blood.
And just looking at body makeup alone, like compared to a human, that's a tremendous difference.
So you keep the pressure and okay.
Absolutely. This per kilogram. And this video is really showing, so it's a lung from a horse that has been removed from a horse, but it's really showing, you can see the lungs are inflating and deflating, and so these lungs are almost like a sponge, but empty, just full of air. And if you think about it, if you take these lungs and you think of the area of exchange between the air and the blood. So if I would take every single of these small alveoli or these small sacs into the lung, and I would put them all flat on a table, I would have the area of a soccer field. So wow. It's huge. So I'm fascinated by, how can you get a soccer field package into a horse, basically. That's incredible. This is really an explanation. So the more lungs you have, the more oxygen and air you can move through your body and oxygenate more blood. And that's an explanation of why these horses are, such amazing athletes. Another explanation is also their cardiac, so their heart system. again, humans versus horses. So an average human maybe has an average heart rate of 70 beats per minute. I know it can go much lower than that, like some athletes are even in the 40s, 50s. But let's say an average person, 70 beats per minute. Well, the horse, an average horse, again, is half of that. And I have athletes, horses and training that are, you know, in the 20, 24, 23 heart rate at rest. Then when you run these people or these horses, so the average person approximately, we know it's not exact, but would be 220 minus your age is kind of the maximum heart rate that you can reach as a human, and you will pump like a maximum probably of 30 liters per minute of blood. Well, look at the numbers of the horse. The horse goes from 35 or less of a heart rate at rest to 230, 240 beats per minute when they are running full speed. And they will pump between 250 and 450 liters of blood per minute. So it's a huge garden hose type of blood of flow, basically. And in addition, horses have they have this huge advantage of having their own blood doping system. So that would be the dream probably of every human Olympic athlete. What they have, these horses, is a big, big spleen that is full of some blood that is very, very concentrated, has a lot of red blood cells. So they have 12 liters of blood that is almost pure red blood cells. And when they get excited and they have to run, they will squish and squeeze these red blood cells into the bloodstream. And so they have a much higher oxygen carrying capacity, we call it. So the more red blood cells you have in there, the more oxygen you can carry. And you can see these tubes of blood that I took, you know, before and after a run on a horse. You can see the bottom one, the black red, is really the red blood cells that are packed together. And you can see there's much more red blood cells on the tube on the right when they run, right? So this is a huge, huge advantage for horses, and explaining a lot why they are, you know, capable of doing this kind of exercise. So, you know, we went over some numbers that are obviously, you know, mind-blowing, but people may say, oh yeah, but a horse is so much bigger. So how much is it per kilogram, right? If you divide per kilogram and you look at what they can do.
Comparing it on the same apple.
Exactly. Well, then they are still 3 times better than us humans. They are, you know, an average human will be able to consume approximately, you know, let's say 50 milliliter per kilogram per minute. So that's per kilo per minute. You do the average horse, and it's going to be 150 milliliter of oxygen per kilogram per minute. And of course, you know, there is a human record of up to 97.5, I think, milliliter. But I've seen many race horses above 200 milliliter per kilo per minute of oxygen consumption, if you want. So these numbers per kilo show that, you know, horses even per kilogram are much more efficient than us in terms of, you know, athletic capacity and transport of oxygen. So we went over, you know, a little bit of some basic explanations on, you know, how can they do it and how can they run so fast and what's their exercise kind of physiology. But really what's fascinating too is what is the limiting factor? Why are they, you know, why don't they run even faster or for even longer time, right? There's a limit to everything, right? And so the limit in horses is the respiratory system. And it's another reason why I'm really interested in studying that respiratory system. So what happens when horses run at maximum speed is that, first of all, we found that, well, not myself, but many years ago, researchers found that they are hypoxic, which means their blood has a low pressure in oxygen. There's less oxygen in their blood when they run than when they are standing at rest. So that's because, you know, the blood is flowing too quickly throughout the lungs, and it doesn't have enough time to grab or pick up all the oxygen it could when the horses are running. The other limitation in the lungs is that they have a ventilation limitation, which basically not only they have low oxygen in the blood when they run, but they also have high CO2, carbon dioxide. And that's probably because of a very interesting thing in the physiology of these horses, it's called a locomotory respiratory coupling. So the respiratory rate of these horses, of thoroughbreds galloping at full speed, is synced with the strides. So every time their feet hit the ground, they are starting to expire, and then they keep expiring when all the legs are in the air, and then they stretch their body and inspire. And so they don't control how quickly they can breathe, and that's a limitation for them. It's also, on one hand, a limitation because we know that they would do better if they would breathe a little bit slower with a little bit more volume of air. But on the other hand, it would cost them more energy to breathe. So now the coupling with the locomotion means that basically just by the impact and of their legs on the feet, it helps squish and expire the air from the lungs for free, basically. They are not contracting as much as if they were breathing on their own. So it has some advantages and disadvantages, but that's basically the limitation of the system. Another limitation, and I'm showing on these figures that, so this figure is basically showing very, my 6-year-old would have done the same probably, but it's really showing in blue, the field, the soccer field, which is basically the lungs and the alveoli that you put flat on a big area. But you have to remember that all the air is only going through the nose and the windpipe to, basically go over this lung field.
And not through the mouth at all?
No, exactly. So that's very interesting, Kelly. Thank you for reminding me that, yeah, horses only breathe through the nose. Yes, they're obligate nasal breathers. And so that's actually where the bottleneck or where the weak link is in the whole chain, because it's a smaller diameter, there is more resistance to the air to flow in the nose and in the windpipe. So it's like really a small, nose and windpipe sending air onto a large soccer field, basically in the lungs. And so if there is a problem in the nose or in the throat or in the windpipe of a horse, then here goes the athletic capacity, that's it. Then you have a big problem with your horse. And so we were really interested in studying that. We have a collaboration with mechanical engineering at U of C with Dr. Theo Freiheit. And we've done some MRI imaging of a horse nose. We've done some computer modeling, and you can see that on the top left and at the bottom right. And then we did some 3D printing of the nasal passages of a horse to study airflow, how the air is flowing in the nose, with the ultimate goal to design a mask so that we could measure airflow when the horses are running. And so we did some computer modeling, and we looked at how is the air flowing in when they inhale, when they exhale. And it's fascinating to see that even in the nose, they have some really adaptation for running, because when they inhale, the air goes straight forward into the nose, and when they exhale, it goes on outside on a 94-degree angle. So there is less, if you want, collapse of the air coming in versus going out. It's like almost having two separate pathways, if you want. So there's more air flowing in and more air flowing out through the nose.
And you see that with the flare on their nostrils sometimes. Can you explain that maybe so I can see it visually?
Yes, absolutely. When they run, they actually open very, very big, these nostrils. And they have some muscles on the top of the nostrils and on the back that really dilate them. And so a horse running has much, much bigger nostrils than when he's standing at rest, for sure. And so we used that computer model, and then we wanted to validate it. So we did some 3D printing of a horse nose, and we were blowing some air through, and you can see, as like any good research, we're using some duct tape here to, patch the leaks, basically. And then we put the mask. So the mask is from our collaborator, Dr. Warwick Bailey at the University of Washington State University. And we wanted to make sure that this mask would work on these horses, would not induce any restriction to airflow and make them, induce any difficulties for them to breathe. So we did test it, on these 3D printed head and nose model, and took a bunch of measurements and basically validated the computer model and validated the mask itself.
Because that's primary new research, not to hurt the animal, not to harm anything, and not to, I guess, interfere with this pure study. Is making sure you can have it exact, right? As if it was breathing in air, but now they've got a mask on.
Absolutely, absolutely. That's the key, and that's why also it took forever to get this kind of equipment. And this is still almost prototype level, and we've been waiting for this for years and years. And exactly, I mean, there's so many challenges. They breathe so fast, and you don't want to decrease the airflow. You don't want to hurt the animals, obviously, and so we always prefer to do it on a plastic model before we try it on a live horse. That's for sure. So this was really a little bit of a summary to put people up to speed with the exercise physiology of these equine athletes. And we've seen, some numbers of when everything goes well and how well they run and how well they breathe. And now, obviously there can be some problems too, and what can go wrong, right? So now I'm going to cover like 3 really parts in the presentation. One is really the upper airway problems, so the throat problems. As we said, it's kind of a bottleneck there. So any small problem in the throat can be a big deal. Then we're going to go over the lower airways, the lungs, and then we're going to briefly go over, cardiac problems too. So let's start with the throat problems first. Let's see. Sorry. Yes. The question is, okay, if something goes wrong in there, how can we see? How can we assess the throat? Well, we use cameras called endoscopes. So it's a long, flexible tube, and we will, at the end, on the tip, have a camera to see, inside the throat. And I'll show you here a video of an endoscopy. So we start with the nose, and in we go to the throat. So this is showing the hole in the middle is the opening of the windpipe. So that's where the air is going. So basically our camera has followed really the path of the air. And so that's nice and, fine when you have a horse at rest. Now, the challenge is what do we do if we want to see a problem when the horse is running? So the problem is, at rest, you can have a perfectly normal anatomy, everything looks good, but when you have the stress of exercise, you have like high vacuum, and blowing air in and out, and so then, things can go wrong, things can collapse, and that's where we need to look inside the throat when the horse is running. How do we do it? Well, many years ago, we had no choice but to use an endoscope next to a high-speed treadmill. So, you can see on this picture, the endoscope is a big machine with a big screen. And obviously, I won't carry that on my back and run behind the horse. So I had to bring the horse to me, to the endoscope, and we had a high-speed treadmill, put the horse on a high-speed treadmill, get the camera in the nose like you've seen on this previous movie, and run the horse on the treadmill and see how he does with his throat. Problem is, this is very far from anything natural. There is no rider. Of course, you cannot jump a horse on a treadmill. Lots of problems. So very, we really needed something else. And that's where a new technology came in, the dynamic respiratory scope. So we were at UCVM, the first in Canada to have that equipment 5 years ago, thanks to a contribution from the Equine Foundation of Canada. And this equipment is really interesting because it's like a scope, but in a backpack. So the way it works is you see the rider has a backpack where you have the batteries, recording system, etc. And then there is a tube going from the rider onto the head of the horse And on the right, you can see that the tube is going on the nose. It's attached to the nose. It's going inside the nose, and then it's looking at the throat nonstop. And then I have a screen, and I can, do a quality control, make sure the scope stays in position, talk to the rider, say yes, collect more your horse, go faster, go slower, things like that, and see what's happening. And then, all the videos are recorded on the backpack, and I can review them in slow motion. This is an incredible technology. I've done hundreds of these now, and I've done them on all sorts of horses. So chuck wagon horses, harness racing, show jumpers, polo horses, even draft horses. So anything really and everything. As long as it's a horse running, we can look inside the throat. And we found lots of interesting things. I'll show you some examples here. On the top right, you can see, even if you're not an expert, you can see that there is something in front on the top right of this opening of the windpipe, and this is the soft palate. On the bottom left, you can see the ceiling is falling down, basically. It's like a collapse, a dorsal collapse of the pharynx. In the middle slide at the bottom, you can see that the funnel is getting really small, so that's a pharyngeal collapse. Again, the horse is like squeezing his throat as he's running. And I think the bottom right one is really self-explanatory. Like basically, I don't even see an opening anymore of the windpipe. It's just more of an X shape because there are some folds blocking the opening. And so this horse cannot breathe as he's running. And I'll show you just a quick video of the throat in action when the horse is running. And you'll tell me, Kelly, if you can see anything wrong on this one.
Well, I'm seeing the water or something, like what?
Yeah, so there's the water cleaning, and if you look at this triangle pointing at us, sometimes it's going to go up. You see, like she's like flipping. So it's going up, and when it's going up, it's basically blocking the opening of the throat of the windpipe.
So ideally that should be open all the time.
Exactly. And so every time she does that, it's like if she was basically blocking completely the opening. There is no air that can flow into the windpipe, into the lungs. And so this mare couldn't breathe as she was running. But if I was looking at her at rest, she was perfectly normal. It's only when she's running that she was doing these kind of things.
While we're on kind of talking about the windpipe directly, we do have a question from our audience asking if you could show exactly where the windpipe runs. This person is a combined driver and says it's always come up when drivers are fitting breast collars because they run across the chest.
Yeah, absolutely. That's a very good question, and I've seen actually some problems sometimes with these harnesses and collars because they are sometimes too tight and they squeeze the windpipe. And I have actually seen on the endoscopy sometimes some almost lesions, some redness where the collar squeezes the windpipe. It's going to be a little bit hard to show, maybe on this slide. I'm going to try again to come back to this slide. So if you look at this horse on the right-hand side, you see this yellow circle, that's really the throat. And the windpipe would go from the yellow circle down along the neck, really on the ventral aspect of the neck. So where you can see on the left of the neck, where the skin ends, basically, that's where the tube goes from the throat down into the horse. And so it's really exposed to pressures from a collar for sure, because it's right in front of the shoulders for sure. Yeah. I'm not sure it's helping. Like I don't have actually an anatomy picture to show for the windpipe. Yes. And so if we come back, okay, so now we've identified some throat problems, and now how do we help these horses? How do we fix that? Well, often, unfortunately, it's a surgery, so, which means, general anesthesia, and we suture things, move things around in the throat to keep things open as much as possible. We have also now an option of a laser surgery, which I'm going to show you in the next video, and also some management. I found it's really important, the stress level, the beats, and all the things like that around, the training and the positioning of the head are really important for the throat. I'll show you here a laser surgery to show you, how does it work, a laser surgery in the throat. So this is done under sedation, standing. You can see the tip there is going to cut that fold, and you'll see that. Oops. Okay, so that's the laser that just did cut a fold that was in the way and blocking some of the airflow. And now we have this big tool that we use to push these folds that we just cut back on the side so that everything stays nice and open.
So were these issues that these horses may have been having, or to clean up these air passages, would you have seen any indication of that prior to being able to get a camera in their throat to find it?
So yeah, it's a very good point. I mean, it's really based on the owner's perception. So the owners come to us and say, hey, my horse is not doing well. I feel he can breathe, or I hear some noise when he's exercising, or, like sometimes it's very subtle. Sometimes it's just, oh, he's not as fast as he should be. And sometimes it's obvious. Sometimes like the horse cannot even go faster than a jog, basically. So there are more severe, less severe cases. It can be very subtle, and that's where we have we have to think a little bit of what's going on, and then if we decide, well, you know what, yes, it makes sense, could be a throat problem, let's have a look, and then we have options. Do we look standing? Do we look with a dynamic endoscope? And then we make these decisions and see what's the best for the horse. All right, so we've covered, these throat problems, which are really clinical applications, and I do these in clinics really. And then, my research focus is really on the lower airway, so on the lungs. There are a few things that can go wrong with the lungs, but recently, as a panel of experts, we met and decided to, keep the nomenclature, the names, a little bit simpler than they were. And we all agreed to call, these inflammatory disease, so not infections, no bacteria, no viruses, just pure inflammation. We are now calling them equine asthma. There is two types of it. There's the mild equine asthma, which in the old times we were calling it IAD, inflammatory airway disease. So again, no infection, just inflammation. So some type of mild asthma. And then we have the severe asthma, like the HEAVs, where the horses are really labored breathing at rest. And actually, I'll show you what they look like here in these videos.
Full time to trot, that's all she did was cough. She coughed like 40 times. But that was before the death.
So this horse is coughing, obviously, but it's a very good performance horse with this coughing problem. So that's one form of mild asthma. I'll show you now another video with the severe asthma. So look at the way this horse is breathing, just standing there. Right, he's pushing with his belly to push the air out.
This horse hasn't come in off a hard racetrack or anything like that. No exertion. It's just there.
Absolutely, just standing there. Didn't run. Was just standing there, and that's how he's breathing 24/7. Yeah.
Now, asthma is a unique term to use because, of course, it's completely relatable to humans. And is it that simple? Are they exactly the same?
No, I mean, the HEAVs one is very, very, very close. Actually, we even tried, the experts working in that field to convince some funding agencies that the horse asthma would be a very good model for human asthma. And I think it's getting there for sure, but it has lots and lots of similarities. Same, even the histology, everything, yes, but many, many things are exactly the same. And so when you see these horses, the question is horse asthma common in Alberta or not? So many years ago, like in 2008, I think we did this field study again where we went outside in Alberta in the barns, and we were doing some diagnostic tests on volunteer horses. And we found actually 66% of horses have some sort of lung inflammation. so 2/3 of the horses there. We found 17% of them have severe lung inflammation, and only 17% were completely normal. And I actually was amazed by, the enrollment rate. So people were very interested in this research in the field. It was my first field research in Alberta, and I was amazed by how, people were really excited and say, yeah, sure, come on, let's please do my horse, and, that was really fun.
That seems like a very high rate, 66%.
Yeah, absolutely. But when you think about it, so then we did some more studies, but when you think about it, the bottom line is horses are not designed to stay in a barn with, dust and things like that, right? So, and we know that even a normal horse without asthma per se will have some kind of inflammation in its lung just by being exposed to dust. It doesn't mean, he's going to breathe hard and cough, but horses don't like dust. Yeah. And so how do we diagnose this problem? So we use some questionnaires. And I'm going to go briefly on these, but basically, these questionnaires are only looking at clinical signs at rest, so they work quite well for severe cases. But the bottom line of the questionnaires is really the last sentence here on this slide. It's really cough. If your horse is coughing, there is clearly something wrong, and you should have, a veterinarian look at it, because we found that the cough is actually the most sensitive clinical sign to pick up on lung inflammation. So cough and lung inflammation are really tightly related and correlated.
In your research, we have one of our audience members asking if you were only testing horses kept in barns.
That's excellent. We did both, actually, pasture, outside, indoor, outdoor horses. So it's a very good question, because, we're always worried of a bias in the study. So it wasn't a perfect study, absolutely. I agree. We didn't have just a control group. But when we published it, it was very well accepted. It was actually a very high impact study in the field. And it was, the 66%, I agree. I mean, if you were taking all the horses in Alberta, maybe you have a little bit less, maybe a little bit more, but it's just to tell you that it's very, very common out there for sure. And so once you have clinical signs, how do you test horses to diagnose lung inflammation and asthma? And so one thing we do very commonly in my lab and in my clinical activities, and that I'm recommending many vets to do it too, is the bronchoalveolar lavage, so BAL. What is it? Well, basically, we go into the lungs as far as we can with a long endoscope or a tube, and you can see the picture on the left using an endoscope, and you can actually see on the screen these bronchi, right? They are like pipes, right? And so we go through these pipes until we are wedging the endoscope, or until we wedge the blind tube. So basically, you don't need a camera in there. You can do it with this white tube on the right side of the screen. And then we flush in some saline. It's all sterile and the same as you would use in a vein, basically. And then we aspirate the saline back, and you can see in the syringe, you get this kind of foamy fluid coming back from the lung. Then we do it, so my lab offers the services to look at the slides. So I receive slides from veterinarians, or I do it from my research or my clinical activity, and we stain the cells from the lungs. And then we look at how many inflammatory cells or bad cells are present in this fluid. And there are many types. So this slide is showing 3 types. You have like some neutrophils, some mast cells, and these nice pink ones on the right-hand side are eosinophils. And look how they look really nice, right? And this is, horses eosinophils are really cool. And so it's going to get a little bit complicated, but we've done lots of studies here looking at these inflammatory cells and what do they do with the immune system. And basically, these horses with asthma are not just one single disease. Like the bottom line on this slide is that there is like a mix of different diseases, in my opinion, that we call still equine asthma. Some have neutrophils, some have mast cells, some have eosinophils. And I think that's an advantage of the BAL. We can characterize better, what kind of cells the horse is having in his lungs that shouldn't be there. And what do these cells do? These, inflammatory cells, well, they basically mess up with the immune system. So it's like allergies, basically. It's like having lung allergies, and your lungs are on fire in this horse, and basically the cells are talking and trying to trigger some allergic responses. And that's what we looked at with some techniques. We looked at what the cells are secreting, basically. And in my lab, we've done some also research where we try to document even better, not just the cells, but also the host. What is the degree of allergy of the host? And we can do that with some special equipment, like you can see here, where we measure how well the horses are breathing, and then we nebulize some histamine. And a normal horse shouldn't care very much and shouldn't, keep breathing normally. And if you have a horse with asthma, then they'll start breathing a little bit harder, and then we measure exactly how this works and how well these horses are breathing. And that's how we treat. We can actually, in the lab, assess treatments for lung inflammation. So we have objective measurements of how well treatments work. And so that's coming down to this slide on treatments of lung inflammation or asthma. So I always say the key is not treat to find the right drug or the right medication. The key is to not expose your horse to dust, which is very difficult to do. If you're a horse, you live in the dust. So how do we do that? Well, we found in the first study that round hay bales are a problem. If you have a horse fed like this on round hay bales, you have twice more chances to have severe asthma in your horse. And why? We think it's because you see in this picture, they dig in their nose into the bale, and so they are exposed to more dust. So how can we prevent that? Well, in severe cases, you can try hay cubes. Fancy, you can even try steaming your hay with these hay steamers, or at least the minimum would be to cover the hay bale with some hay net so they don't dig in it. And I still have to assess if that works really well or not. And then we can use medications, and I'll go very briefly on these medications because, as I said, this is more of a veterinary field type of thing, and we've done some studies. But the take-home message is that the medications, if we use dexamethasone, which is an injection of cortisone, if you want, you treat the whole horse, the whole body, to treat the lungs. And so you deal with side effects. And one of the side effects that we all fear is the founder or laminitis, which is shown on this picture, where the feet, so the bones on the feet, this triangle bone is detaching from the hoof and going down and pushing on the sole. So that's what you don't want to see happen, and that can be definitely a risk with these treatments. So that's why another option is to treat only the lung. So why would you treat the whole horse if you can treat just the lung? And that's where we use inhaled steroids, and we use these devices, same as humans, where we put them on one nostril on the horse, and we puff the horse, and they get this human medication that I actually send my clients to the pharmacy, and they buy human medications. Do they work? Yes, we found that they do work. We've done, again, these studies. You can see here how it works on the nose of the horse. It goes on one nostril, and you puff like your kids with asthma. And the only problem is the cost, right? I mean, you're using a human medication that's quite expensive at a horse dose. So it's really expensive, and that's definitely a limiting factor, and that's why we're also looking at other options right now for this treatment.
With the high prevalence of asthma, as you've kind of gone over here and stuff, are you seeing any genetic markers in horses for that?
Yeah, that's an excellent question, Kelly. So there is definitely a group looking at genetic markers for hives. And they found, it's still not super precise. So we don't have one or two genes with some mutation problems, but we know that there is an area on the chromosomes that is actually, suspect area basically, and so we do know that there is some hereditability for hives, for sure. That's for the severe one. For the mild asthma, nothing yet, and I don't even think it's so common. It's probably not a genetic problem. But for hives, yes, absolutely, 100%.
And is it as common in other parts of Canada and in other parts of the world as it is here?
Very interesting question. Yeah, it's actually, the more horses are kept inside, the more common it is. So in Alberta, we're actually lucky with severe hives, like I found 17% in that other study, right? In Switzerland, for example, there's a study where they found, I think, almost 80% of the horses with severe hives, because they have older population of horses that are kept inside much more than us here, and so they get more hives.
And with the diagnosis of asthma, should we be stopping our horses from competing? Is it a sign that they shouldn't be exercised as much or, kind of running full out as much?
So with severe asthma, definitely yes, and actually the horses can't even exercise very much. They are like people with asthma in crisis, right? So there is no way you can exercise a horse like that. With mild asthma, again, there is a panel of, it can be very subtle or it can be more pronounced. Then, you have to use your judgment. But yes, definitely, it will decrease performance anyway. So if you're in competitions with a horse like this, absolutely, for your horse and even for yourself, I mean, you should definitely treat it for sure. Sometimes it's very subtle though, right? So, but as soon as it becomes obvious, absolutely, I mean, you need to treat that, yes. All right, so we've covered, for the lungs, what can go wrong with asthma, and now another part of aspect of my research is on the bleeder. So it's called EIPH, so exercise-induced pulmonary hemorrhage. So what is this? Well, EIPH is really when horses bleed from the lungs when they run really fast. And that's very common in horses that are racing at high speed. And one study even found up to 80% of them had traces of blood in the lungs. And often it's paired with poor athletic performance. And so we're not talking, pouring blood in the lungs. We're talking like some blood that is oozing into the airways, and then you can find it in the lungs. And so why do they bleed? Basically, there is a push-pull mechanism that I'm trying to illustrate at the bottom of this slide here, where the red is, the pipe is like the artery. So you have a pulmonary artery that carries blood, and horses have marked pulmonary hypertension when they run. So the blood pressure is very high, which pushes these red blood cells out of the blood vessels. And in blue, you have the alveoli, which are the sacs where the air is. And when horses run, they have actually a very high suction or negative pressure of vacuum into these alveoli that are actually pulling these red blood cells in. So between the push and the pull, these poor red blood cells are, sometimes like oozing out into the alveoli. And then you can find them in the lungs. And so how do we find them? Well, we do the BAL that I described before, and you can see these jars at the bottom left, right? On the left is a normal one, and on the right is a horse with some EIPA. So the jar is pink reddish, it's not like just pure blood, right? It's just diluted with saline here. And we can even find on the BALs that they digest the blood. So I have a history, like even if a horse bled a week before, I can still see some digested blood in these BALs sometimes. And another way to diagnose it is to do an endoscopy like we've seen. And now we're going in the windpipe with the endoscopy. And we can grade the bleeding. So you have, this is from a study we published. So on the top left is a grade 1, a B is a grade 2, and C is a grade 3, and D is a grade 4. And so when we did a study, we published in June or July a study on the barrel racers, and we found we were interested in looking at how many of these horses are bleeding because it's never been reported, and it's only been reported in race horses basically. And so we found, let's go in the field again and look at these barrel racing horses. We've done 170 endoscopies, and we found that more than 45% of them have some EIPH. And interestingly, only 5 of the bleeders had blood coming out the nostrils, like shown on this picture. So it's mostly internal bleeding. The blood is slowly coming into the airways, going up the windpipe, and the horses swallow it, and the owners don't even know it. And when you look at the bar charts here at the bottom, like you can see most of them have a mild score, right? It's a score 1, 2, 3, and very few have a score 4. But still very present in there. And it's a disease that is the focus of much attention for research. We are actually writing a grant. Right now, I have a grant due on Monday for EIPH. And we're trying to find some solutions for these horses. The bottom line is right now, there are a few things we do, like diuretics, like flare strips on this picture, but really, we need a lot more research in that field. We don't even understand fully how it works, and we're far from having a good treatment yet.
Is it unique to barrel racers?
No, so we were the first one to really show it in barrel racers, but it's well described in race horses. So that's really, and you know what, I know by, my experience and talking to veterinarians that short jumpers have it too, and, it's across many disciplines. So we've covered, like what can go wrong with the upper airways, the lungs. So we've done asthma and bleeding in the lungs. Now I'll briefly go over, another aspect of my research on the cardiac problems, because I know it's been publicized a little bit at one point. So what we use, we were really the first ones to do some electrocardiograms of good quality on horses, running full speed in races at the track. It's challenging because, there's lots of movement, the electrodes have to stick, and you need to find some associations that let you even, do some ECGs on the horses running in some races. And so we were lucky to have the study going with the chuck wagon horses. And you see the heart rates are very, very high, like we're talking 220 plus beats per minute. And so the ECG allows you to look at electrical activity in the heart. And things can sometimes go wrong, like I'm showing here, this red bar, you can even see there is something that is different from the other waves there. And that's when you have sometimes ventricular depolarization, premature depolarization or contraction. And so we're looking for, abnormal electrical activity in the horses when they race. And so we've done that on the truck wagon horses where we had 13 teams, so that was again a huge number. I was again amazed by how interested these people were in the study and enrolling 148 horses. It's huge, and we've done more than 350 ECGs on these horses, so electrocardiograms to look at the electrical activity. This was very long and painful to analyze, but what we found, the bottom line is maybe we should look here at the bottom graph on the race ECGs, and really what we don't want to see is the yellow ones like the VPC. So these are, the abnormal electrical activity that we think, this could be a problem. But in the truck wagon horses, we found that there were only, a single isolated event once in a while, and there were a very, very small percentage of the abnormalities. And so that's showing us that, they're actually doing very well in terms of electrical activity with this racing. And I have never seen an ECG where I was even worried in these horses during the race. And looking back at some literature, we had with the recovery problems and the warm-up and rest, we had the same prevalence in these horses, so the same frequency of abnormal electrical activity in the heart as harness racers and even some short jumpers. So that was an interesting study. And then we were still, trying to help, the industry prevent a cardiac problem before the horses reach the track, right? So you want to see if there is a marker or a way to figure out, is this horse at risk of, having a trouble and some problems on the track. So we validated with a collaboration with Calgary Lab Services with Isold Faden Long. We validated a new test for humans. So it's a high sensitivity troponin assay. And we took basically a lot of horses, pulled some blood, and tried this assay on these horses to detect, with a high sensitivity assay, cardiac muscle damage, even before it becomes a problem when they race. So our goal was basically to use that test as a screening tool. And basically, if you have a horse going in the race, you take the blood, you see the result is very low, good to go, green light, go race. And if you have a high level, then oops, you may have a problem there and you shouldn't race. So we use that test before racing, but we also use it after racing, and we are publishing another study where we look at how do you use that test. And basically, it's a good test when you sample the horses 3 to 6 hours after the race. And then you'll see a peak of troponin that will go up in these horses. And then we know exactly what is safe and what is too much, basically. So maybe time is flying. I'll briefly, summarize. So what did we learn? And I hope, that was the message went through. But, first, we went over this introduction and showing that horses have these incredible adaptations to run, right? And that the limiting factor is basically the respiratory system. We also learned that any nose or throat problem will affect the airflow and athletic capacity dramatically. So this has to work well if you want the horses to be, healthy and working well. We also found that many horses have mild asthma and a few have severe asthma. And we also found that many horses exercising at a high level have lung bleeding, so racing, barrel racing, and I'm sure other disciplines too. And we looked at, electrical activity in the heart, and we found that the severe problems in these hearts are actually very rare. And we validated some markers of cardiac muscle damage that we can use in practice.
Which will be very good news to owners.
Absolutely, yeah, and that's really what motivates us to do this kind of research. And so now, where do we go from now? Well, I like new technologies, and there's always a need for these in the field to help us answer these research questions. And so, what really we need is a portable system to measure VO2 max, which we are, again, we have now with Dr. Warwick Bailey from WSU, and so we're just starting to use it in some studies. And it's critical to have a VO2 max measurement in the field, because then you can assess the fitness of the horses, you can have safer training protocols, better training protocols, you can really test training options and new things like the water treadmill. For example, we have some very exciting data that we're going to publish very soon on the effect of water treadmill on conditioning horses. And we and others, as I said, we're writing a collaborative grant right now on working on the IPH. So this is really important to us. So this is where we're going. Just a picture showing that the joys of doing research in the field with computers in the back of a pickup truck and lots of equipment and students. And this is, more pictures on the mask that we are using now in different studies, and polo study, barrel racing studies. And on that note, I'll show you this concluding video on, bye-bye.
Incredible. Now we have a lot of people that have questions about your presentation, so we want to get to a few of those. And a lot of folks are writing in asking about the nose strips and, do they work in helping with the intake of air?
Yeah, so they do work. There is some studies that have shown, but it's a it improves it by a very small percentage. So I always tell the owners, it's really only good to prevent the IPH if your horse is on the edge. So if he's barely bleeding, sometimes he does, sometimes he doesn't, and really on the edge of bleeding, he needs that 3-5% improvement. That's perfect. Then yes, use the flat strips, and I do recommend it. However, if your horse is a very severe bleeder or has no bleeding problem at all, then if you have no bleeding problem at all, you probably won't change very much anything with the flat strips. And if you have a severe bleeding problem, well, you should try to figure out why you have that problem, and the flat strips won't, solve all of your problems. No.
And Renaud, on the asthma side, a few people are asking about sort of what's safe and what's not, and they're wondering if you found a perfect marriage of how much time is safe in the barn to prevent asthma or to help decrease it, I guess.
That's, a very good point. I think it's more the quality of the air. If you have no dust, no mold in the environment, and the trick is sometimes they're microscopic. So I go sometimes in brand new fancy barns, very, pleasant to be in, etc. But then you may have some microscopic molds that are actually invisible. You can't smell it, you can't see them, but they go in the lungs. And actually, the smaller they are, the deeper they go in these lungs, and they are the ones that are creating damage. So if you have a very good environment, I think it's fine to have your horse in a barn, for hours and hours overnight, and even 24, hours if the air quality is really good. But it's hard to assess the air quality in a barn. So you have the dust that you can see sometimes that looks bad, so this is clearly not very good. But as I said, you also have these kind of vicious dust particulates that are invisible, and these are the ones that are actually the worst for the horse.
And what about people who trailer their horses? We have somebody asking, they have hay in their manger, there's a lot of wind and dust, and I think that a lot of people could relate to that.
Excellent point. Yeah, absolutely. This is very bad. Like you are trailering usually to go to compete, or show or whatever. So you need your horse to be in top shape. And actually, the trailer is full of dust. You have a hay net in front of your horse, the bedding, you have the windows open, the air and the dust is like, moving around. So I usually recommend, first of all, no hay nets. And if you want to do something, maybe use a bucket with hay cubes for trailer. Wet the shavings or minimum shavings in there, a little bit more wet than they should be to avoid the dust. Or, I have people using even portable hay steamers for the horses when they go in the trailer. But absolutely, this is a very good point. The trailering is a big problem.
I want to thank you again, Renaud. This is an excellent presentation. We always have more questions than we're able to answer, so I really want to thank everybody for participating today, and I apologize if we weren't able to get to your questions. I do want to mention that this presentation is only one of a series of webinars we're doing with our experts. As you take a look at some of the ones to come, you can sign up for these webinars or download our ebooks by going to ucalgary.ca/explore/collections, where you can check out the research. There's videos with our experts, and there's a story there with Renaud if you haven't had an opportunity to take a look at that. Also, if you have any ideas for us, we certainly want to hear from you, and you can contact us by emailing us at ucalgary.ca. That's not where you're going to email us. Just one second. Let me get this on your screen now. You can email us with your ideas at exploreUCalgary@ucalgary.ca. And thank you again, Renaud. It was a pleasure speaking with you today.
Thank you very much, Kelly.